If you're considering a prostate check, you've probably heard of the PSA blood test. PSA, prostate-specific antigen, is an important and well-established test. It's widely used across the NHS and it's undoubtedly helped detect prostate cancer in many men throughout the world. But it's only one piece of information, and it can rise for a variety of reasons. Mostly benign enlargement, inflammation, you could have ejaculated within the last few days, you've been cycling, or you had a urinary infection, or maybe a urologist has investigated you. Sometimes PSA results, they sit just in a borderline range where it isn't immediately clear whether it's where it should be. So here at the Health Suite, we will offer a structured prostate assessment, just like you do in the NHS, and try and bring some clarity to that uncertainty. So begin in the same way. Look at the PSA results. We interpret it based on your age. What's your ethnicity? Do you have any family history risk factors? Have you previously had treatment for your prostate? All of these will help determine what your next step may be. It may be that we don't need a next step and that we can reassure you and you can have community follow-up with PSAs every 6 or 12 months, or maybe not. Or we may need to direct you to an MRI scan, and then based on that, whether or not we need to do a biopsy. So PSA, is it in the range? What are your risk factors? And if there's some uncertainty, do we need to do further tests? To take that further, there is the Stockholm 3 protocol, which doesn't just look at PSA, it looks at multiple prostate-related proteins and genetic risk factors, and it looks at your clinical factors that estimate your likelihood of having significant prostate cancer. This allows us to make a more informed and in-depth decision about whether you genuinely need an MRI or whether monitoring is safe and appropriate. And in a sense, this helps us reduce unnecessary investigations, but maintaining vigilance for significant disease. This service is particularly relevant if you're over 50 male, or if you're over 45 with a strong family history or black ethnicity, because men with family history or who are black have a slightly higher risk of having prostate cancer. Men with a rising PSA, we also want to know why is it going up. And this allows us to have a structured approach to screening. Our aim is not to overtest, and it's certainly not to replace existing NHS pathways, but to provide a clear, evidence-informed triage strategy so that each step is proportionate, considered, and clinically appropriate. If you'd like to discuss your prostate health, understand your PSA more clearly, or explore whether the Stockholm 3 testing protocol is for you, you can book a prostate assessment and consultation with us. We'll guide you through it appropriately and safely.